Thank you, Dr. Shai, for that kind introduction, and thank you very much for the opportunity to speak as well. It is my true honor. I'm going to be talking about advances in retinal surgery, primarily in treatment of retinal disorders. These are my disclosures. We currently have 4 anti-VEGF agents on the market that we frequently use for treatment of wet macular degeneration as well as DME. And we all are very familiar with these agents. But that treatment has been really much stalling for the last decade or so. So we're excited to see that there are many new drugs in the pipeline that hopefully are going to address the biggest problem in retinal care currently, which is the frequent need of injections and really unable to keep up with the burden of treatment for our patients as well as for physicians themselves. So the current drugs have very much increasing durability of the treatment, and some of those are sustained release options. And you can list, there's a laundry list of the drugs coming down the pipeline, and we are very excited that some of these will be quite promising. And I'll be limiting my discussion to primarily the ones in phase 2 and above. And really, as we look at these drugs, we would group them into 3 categories: intravitreal injections with really longer duration. Some of these are intraocular sustained delivery implants, and lastly, gene therapy. So we'll start with the intravitreal injections. The brolucizumab, which is recently approved drug for treatment of wet AMD, is a much smaller molecule as compared to other agents that are on the market. It is, for that reason, favorable because it does penetrate well tissue. However, there has been reports of intraocular inflammation as well as incidences of occlusive vasculitis in these patients. So those are some safety issues that are currently ongoing and being investigated further. And the further trials for DME are very much enrolled in phase 3 and now showing promising results, just like what AMD treatment has been as well. The Kodak Sciences has KSI 301, which is a interesting conjugate ABC platform, which allows for longer duration. It actually allows for Q3 to 5 month dosing versus currently what we have in terms of aflibercept, which is a Q8 week drug. So exciting to have a longer duration options. And currently this drug is also in phase 2 trials for wet AMD and DME. The next exciting option is this depot formulation of sunitinib, which is a gray bug product. This type of drug, it will inhibit all anti-VEGF agents, being VEGF-A, B, C, and D, as well as the DLK inhibition. So it's essentially blocking all the VEGF receptors, which is for that reason promising. But really the interesting part is the fact that it comes as a depot form. And you'll notice in these lower images, fundus images, that the drug itself is injected posteriorly, it expands, and it's kind of this formula that really degrades very slowly over the next few months and lasts as long as 6 months in duration. There have been some reports of migration of this drug to anterior segment, which since the company has slightly changed the formulation and is further investigating this in ongoing trials. Genentech or Roche has brought us recently faricimab, which is for the first time a biphasic antibody designed not only to attack anti-VEGF receptors, but also Ang2 or anti-Ang2. And for that reason, it's promising to enhance not only block the leakage, but potentially cause a vessel stabilization and healing. And this drug is currently in phase 3 trials for wet AMD and DME, and recently was reported at the Macular Society as well, the vascular polymer angiogenesis course, that really promising phase 3 results for this drug and lasting as long as 16 weeks in generation and simple intravitreal injection. So clearly there's quite a few intravitreal injection forms coming down the pipeline that are very much promising to increase duration of the drug in the eye and help us with treatment of wet macular degeneration and DME. Now we're going to be moving on to sustained delivery implants. Being that I'm a surgeon, I'm always very excited about surgical options. And this is an implant, a reservoir that can be implanted beneath the conjunctiva and left there. And then it can be refilled every 6 months or so with a refillable needle in clinic in office procedure. And in current phase 3 pivotal trials, Archway and Portal, they're showing that exactly that duration of this drug or slow elution of this drug lasts for about 6 months or so. And some patients can actually go as long as a year without any refills. And further investigations are ongoing with phase 3 trials for DME, which are Pagoda and Pavilion. And you'll notice it's actually quite a simple design where there's very slow dilution of the very high concentrated drug in the implant, making its way into the eye, and slowly by passive diffusion, really passively passing into vitreous cavity. And the implantation is quite simple and reminds us often of glaucoma procedures, where we're taking meticulous attention to the sclera, kind of cauterization, accessing suprachoroidal space and then choroid itself. And really, you'll certainly see that this implant is just injected and then meticulously covered with tenons and conch to ensure there's no erosion or potentially infection down the road. And here are some images of the patients with this implant. And as I mentioned, the clinical trials phase 3 are ongoing, but showing quite promising results currently. Now we're going to be moving on to gene therapy as a delivery approaches of anti-VEGF blockade. And there are a couple of companies that are looking to treatment with gene therapy for wet AMD and DME. First being Adverum, which involves an intravitreal injection of AAV vector. This vector particularly would be producing a aflibercept coding sequence. It has already been fast-tracked by the FDA, and currently their phase 2 AMD and DME trials ongoing. While it's exciting to have intravitreal injection as an option, there has been reports of inflammation associated with this approach, and kind of further investigations into this have been ongoing, but again, quite promising. And last is a gene therapy delivery as a surgical option. This is by Regenexx Bio, RGX-314. Our clinical trials kind of looking into these options. And they are looking particularly in delivering a gene therapy product in subretinal location, intravitreal approach, where we are using subretinal needle to deliver it there. This approach delivers the drug exactly what it's needed in subretinal location. It kind of bypasses these inflammatory responses from the eye itself. So the studies have shown that not only promising results in terms of not needing recurrent injections in clinic, but also minimal rates of inflammation as well. So exciting approaches coming down the pipeline, and this company is particularly looking at further studies, phase 2 and 3 for the subretinal approach, looking at DME as well in DR as an option, but also now investigating whether this gene therapy drug can be injected in suprachoroidal space and can aid in blockade that way as well. So to summarize to you, we have quite a few exciting pipeline drugs for neovascular AMD and DME coming to potentially market in the next year or two. Some of these are promising phase 3 results. Overall, I think I'm excited that they're not only targeting VEGF, but also other markers, and gene therapy, I think, is going to be an exciting way of changing the management of these patients. So readouts are coming, and future seems quite bright. And thank you again for listening in, and thank you for this opportunity to present and share data with you. And these are my contacts on via email or LinkedIn. I'm going to pass it back to Dr. Nujum to speak just a little bit more about women in ophthalmology.